introducing our second keynote speaker, Dr. Kathleen Ethier. She is a social psychologist and the director of the CDC's Division of Adolescent and School Health and the National Center for Chronic Disease Prevention and Health Promotion. Dr. Ethier's work at the Division of Adolescent and School Health focuses on improving the capacity of schools, families, and communities to help youth become healthy, successful adults. She and her colleagues do this by working to decrease the prevalence of behaviors and experiences that contribute to HIV, STDs, and unintended pregnancy, advance health equity through the reduction of disparities and experiences that that contribute to unintended pregnancies, increase the implementation of strategies that promote the protective factors that contribute to healthy youth development. This work, we feel, and this is why we invited Dr. Ethier, is really vital to improving the physical and mental health of our nation's youth, and we're really excited to learn more about the state of the art for these efforts. So join me in welcoming Dr. Kathleen Ethier. Thank you.
Thank you all so much. I'd heard the Surgeon General this morning, and I, excuse me, really appreciate that you all stayed. So this is my first trip to Des Moines, and I'm so happy and excited that it could be for this day of such important conversations about the health and well-being of our nation's young people. One of the real glimmers of hope for those of us who've been working in this area for a long time around adolescent behavioral and mental health is the attention that and focus that these issues are currently receiving. We might be on a different path if we had been having this conversation, I don't know, 10, 15 years ago, but I'm so glad that we're having it now. I recently spoke to an audience of school administrators and asked them to raise their hand if the behavioral and mental health of students was in their top 3 priorities. And there was not a single person in the room who did not raise their hand. We know that schools are grappling with the mental and behavioral health issues of their students every day. And so really happy that many of us and many of you in this room started working on these issues a number of years ago so that we really can meet this moment where we are being called to provide real recommendations for what schools can do to improve young people's health and well-being. So why school? We also know that social and emotional learning concepts, when they're built into different aspects of the day, can really make a difference in helping kids manage through their days and supports and really supports health and well-being. And teachers need support. So that can come in the form of professional development. It can come in the form of making sure that our teachers and our school staff have access to things that support their own mental and behavioral health. But we also know that teachers who feel better in a classroom and are better able to manage what they're seeing in their classrooms in terms of the mental and behavioral health of their students. I want to call out my friends at Inner Explorer. I got a chance to go to an elementary school who was using the Inner Explorer program, and it's a mindfulness-based program, and I'd never seen it in action before. And in an elementary school, there is absolutely nothing more adorable than first graders practicing mindfulness, singing a mindfulness song, and it was just the most adorable thing I've ever seen. But I will also say that seeing a 3rd grade classroom and a 5th grade classroom and a 4th grade classroom all using these practices was one of the calmest elementary schools I have ever been in. Like, you could feel a difference. And that was whether or not they were in math class or reading class or whatever class they were in. And so there are ways in which we can support mental and behavioral health in every classroom aspect of children's days. Put together, we did we started this project in 2019, even before the pandemic, because we saw that the data on youth mental health was moving in the wrong direction. We realized that schools were going to need support in how to handle that, and so we went, as we do at CDC, we went to the scientific literature, but we went beyond that. And so I'm going to talk a little bit about how we developed this guide. But it's the Promoting Mental Health and Well-Being in Schools, an action guide for schools and school and district leaders, is meant to kind of fill in the gaps. We know that schools are working so hard on these issues, but we know that they could always use additional ideas to support additional work. And we also know that they've been heavily focused on trying to bring services into schools or get kids to services. And we wanted to provide something that was not service focused. So the strategies and approaches in the action guide were identified really using a combination of methods, including the peer review literature, but we also went to the gray literature. We did expert listening sessions and focus groups to help provide contextual information and ensure that there was a focus on equity and that implementation tips were provided and considered existing policies and practices and programs that schools were currently using. After we went through this process, we ended up with 6 strategies that are proven in the literature, but that also we had a lot of discussion with people who were actually going to need to put these strategies in place, so that we weren't just throwing them out there like, here's what the literature says, that we really were going to be able to say, yeah, this is what the literature says, but this is what we know. These are the challenges that we know you're faced with because we've talked to so many different people, and we can give you these tips on implementation, and here's how you focus on equity. And so each approach includes specific mental health outcomes that the strategy is proven to impact, including outcomes with impacts on potentially diagnosable mental conditions, but also like really broad mental health outcomes like stress, and assets like positive coping strategies. Each approach also provides example programs, although this is not it's really examples. It's not meant to be an exhaustive set of programs, policies, or practices, and demonstrates how it can be then put into action in schools. We also understand that schools have been making behavioral mental health a priority and are using the multi-tiered systems of support as a framework for doing that. And so we say in the guide kind of what tier that strategy focuses on. Most of the strategies in the guide are focused on tier 1, clearly because they're meant to be prevention, they're meant to be upstream, they're meant to be universal. But there are a couple of strategies in there that get at the tier 2 level and a little bit into tier 3. But we really wanted to stay in the place of, you don't need a mental health professional in order to implement these strategies, and they can be provided to a whole school. So these 6 strategies include increasing mental health literacy, which I mentioned as part of quality health education. Increasing that literacy is incredibly important. Promoting mindfulness, so another shout out to my friends at Inner Explorer. Promoting social, emotional, and behavioral learning. I just do want to say that I understand also that SEL as a thing has been getting some pushback in recent years. We've been trying to expand that a little bit and stay kind of outside of the very specific SEL programs, and to say programs that focus on building social skills and understanding emotions and behavioral decision making that are science-based and so have evidence of effectiveness are really what we're focused on here.